Dr. Abbasi, Assalamu alaikum, and thank you for joining us.
Walaikum salam, Faizan. Thank you for inviting me.
So, ladies and gentlemen, Dr. Abbasi here is a medical doctor, and she is working for the Department of Psychiatry here at Michigan State. And she is on the forefronts of mental health movement, especially the Muslim mental health in the US, amongst other distinctions and awards she has. I cannot even list them right now. She has been doing so much, and there's so many ways she inspires me. So it's such an honor to have you, Dr.
It's very mutual, Faizan. You and your wife, you continue to inspire me as well. So thank you.
Thank you so much. So before we jump into talking about mental health and the coronavirus situation, why don't you tell us a little about what you're doing nowadays with the government? I saw you just came off from a meeting with the deputy mayor, right?
Yeah, so let me tell you a little bit about myself, like being a mental health provider. When I started practicing, I realized a lot of our focus was on mental illnesses, like how to treat mental illnesses. But slowly, gradually, the movement have gone towards mental health and how can we promote our well-being and prevent diseases from happening. Of course, there are some genetic predisposition, but there is a lot of things we can do for our mental wellness. And one thing I learned from myself is that whenever I feel anxious or feel overwhelmed, it helps me to go beyond my own problems and focus. And this volunteering and reaching out to people, connecting to other people has been really helpful for me. So I feel like when you are trying to heal others, you are actually healing yourself too. So when COVID-19 happened and, all the uncertainty, fear and anxiety surrounding it, usually when a traumatic event happens, it happens for a certain period of time and then, it ends and you start focusing on recovery. But with this kind of, we are still grappling with the disease. It's evolving every day. It's changing its presentation. It's still spreading. And we don't even know how much it's going to have the impact on us, right? So one thing is sure, even if you don't get COVID-19, you will definitely still be getting huge impact on your mental and physical wellness because of it. So again, using my own defense mechanism, I decided that I can sit and just worry about it or do something about it, right? So I have been using this time to do a lot of webinars, educating people, creating more awareness. So I've been doing webinars through the university, through Islamic Center, and through the city as well. So the mayor of Lansing, Andy Shore, had already announced a mental health task force, but it's now it's more, if we're getting like more, being more organized given the crisis that we are anticipating. And they invited me to chair it. So today was the first webinar in that series.
That's wonderful. So here's my question. Before I jump into the main question, you have been studying and working with different ethnicities and different cultural, religious backgrounds for mental health. Do you think people take it very differently when they face situations like this based on their backgrounds, or it's kind of a general human behavior that you observe?
So what I see is the symptomology can be very similar, right? There's certain way a mental illness can present. So how we look at it is in sense of severity and functionality, right? So either people get severely anxious, depressed, or at what point they become aware of it is when it starts to affect either their relationships, their work, or their functionality in the society. So I do see the symptoms might be similar, but the perception of disease is very culturally defined. So like, let's take our South Asian culture. They will never come and say, oh, I'm depressed. There is certain vagueness about it. It's more physical symptoms. Mera sar ghoom raha hai, like my head is heavy, my heart is heavy. So it's like more like a somatization. And unfortunately, a lot of the reasons behind it is the shame and stigma associated and affiliated with mental illness that we tend to. And also another reason behind it is, if you talk in physical sense, it's more tangible and you tend to get more care and understanding around it, versus if I come and say, oh, I'm anxious, I'm depressed, people say, what does that mean, right? You're fine, you're walking, you're talking, what's wrong with you? So I think so we tend to somatize more, and that's what we see in a lot of minority settings. So perception of disease is one thing that differs across the cultures, but also how we access care is defined by the culture. That's why, for me, it was very important that instead of having an standardized treatment goals, which we will always go to, but adapting it to different individual cultures.
Right, that makes sense. So how should we deal with it? I mean, I'm throwing a very general question at you, and I know that there will be a lot of detail and there will be a lot of specifications in your terminologies, but as a layman, if I want to ask you, how should I remain sane, remain productive, remain happy during these times when I cannot meet people, cannot go out, cannot have job, for example, and don't have income in some cases? What should I do to train my mind and keep myself calm?
So it's very interesting. Human beings are very resourceful and we are very flexible, right? We are very innovative too. But when it comes to mental illnesses, I think the basic initiative, that initial thing that we all have to do is become aware of it. First, acknowledging it to ourselves that something is wrong and we need help with, is going to be the first battle that you have to overcome. Then comes, like, if you're seeing this in a loved one, then you accepting it, right? Like, okay, yes, mental illness is as relevant and valid as a physical concern, right? Being more accepting and then negotiating care is the excess becomes the third thing. I think when it comes to mental illness, what I see is even people, like right now, I just saw the statistics and it just concerned me so much. Right now, we have a suicide rate in physicians of like 300 physicians complete suicide every year. But if you look at how many of them access mental health care, very few. So people who, like non-professionals who complete suicide, they might be accessing care more than professionals. And this is what the stigma does to you. And that's where I thought, like when I started working, it's been almost 15 years that I've been working on forefront of this mental health concerns, that I realized that until unless that stigma, and it's interesting, stigma starts within yourself first. Things always start within yourself. Once you have to be comfortable with it, that, okay, I am depressed, I am. Another thing I keep talking about is visibility is viability. Unless we make things apparent, acknowledge the need, we will never find the cure for it. So a problem with mental illness is it's so hidden. It's still shame, stigma, secrecy, that we kind of keep it buried down unless we see people from our communities in really crisis mode when the outcome is already gone too far. So that's why early intervention is very important. But coming back to what this right now, what we can do is focusing on, always in any challenge in life, any situation, always focusing on what is working rather than not working. Like literally when वो कहते थे ना, your grandparents and everybody count your blessings or shukar karo. If you go and look at the successful habits of successful men, what are the few things that were already told to us were gratitude and volunteering, right? Those are the two things that we can do. And again, it's very interesting, like up till now, all the research on mental health and social media was that how social media is impacting our capability to communicate, how it actually, the youth and everyone is losing the social norm of one-to-one interaction because of social media. But now how our cognitive reframing has happened, and we are actually getting dependent on this social media, and it's not going away. Like even in medicine, telepsychiatry, therapy, everybody's doing more virtual care. And I think we are going to see more and more dependence on it rather than going away. So that's what I say. We are very resourceful, but you have to continuously reframe your negative thoughts. Cognitive reframing is a huge tool. Something like, oh, I'm forced to stay in the house versus I'm choosing to stay in the house. Just a simple change is your perspective. Or I talk a lot about trauma-informed care. Just a small change in narrative, like instead asking somebody about mental health or anything, is our attitude is, what is wrong with you? Why are you acting this way, right? So instead of saying, what is wrong with you? What wrong happened to you?
Right.
So that is where the cognitive reframing comes, and it's a huge tool to rely on.
Yeah, I can now relate to it so much. There were so many things that I personally used to think in a certain way, and only changing or tweaking the perspective a little, it's now a lot different. So yes, I think that's where the key lies, to understand yourself better and be more grateful, and also look to others and try to provide care that also helps. Thank you so much, Dr. Basi. I will not take much of your time. You have been busy all day already, and I am really, really thankful that you made it for me. Any last words before we part?
I think we need to be very comfortable in my message to youth always is that find your authentic self. And being authentic means you're not perfect, but you are very aware of your weaknesses and strengths. It is so important to have that insight in your own self, because then neither criticism nor compliments matter, because you know what the truth is. And being comfortable and accepting of your own truth is the strength. So that would be my message.
Wonderful. I'm going to steal these lines. I'm going to tell people.
Please do.
So I'm telling you all in advance. Thank you, Dr. Basi. Have a wonderful rest of your day. And I hope I see you before I leave. I'm definitely going to see you before I leave.
Absolutely. And I'm going to have Rabia's ladoos. There's no eyes on that. You take care. My best.
Thank you so much. Bye-bye.
Bye.